Hello friends, welcome to the Healthcare Today. Today I am going to talk about urinary incontinence. Now, very briefly, I will be talking about what is urinary incontinence, what are the types of urinary incontinence, and how you can manage or get urinary incontinence treated. Now, urinary incontinence is involuntary passage of urine or leakage of urine without your control. That means you don't want to pass urine, but the urine gets leaked. It can be a leakage on coughing, you cough, you sneeze, you laugh and there is a leak. There is a mild leak or a big leak. Then you have an urgency to go to washroom again and again. You've just passed the urine, then you want to go again. And at times you feel that before you reach the toilet seat, the urine leaks. Now this is the urgency incontinence. The stress incontinence was what I was previously discussing, that you involuntarily leak urine while coughing, sneezing, laughing and during intercourse. Now there can be a mixed variety which can have a component of stress and a component of urgency. So it is called a mixed incontinence. And let me tell you, dear ladies, that 1 out of every 3 women have got incontinence, because the medical statistics do say that the incidence of incontinence is between 30 to 60%. That means at least by the most conservative estimates, 1 out of 3 women have urinary incontinence. Now then why don't they get treated? And if you ask in your family today, to your mother, to your sister, to your aunt, to your grandmother, to your daughter or anyone, your friends, your colleagues, you will find that a lot of women are suffering in silence with urinary incontinence. And I urge you all, the ones who are watching me here and have incontinence, or someone in your family or friend circle has incontinence, to not to suffer in silence, speak up, because now incontinence is treatable. Urinary incontinence can be treated in different ways. Stress incontinence, it can be treated with surgery as well as with non-surgical modalities. Urgency incontinence has non-surgical management, no surgery is required, and mixed incontinence, it develops what is the degree of incontinence. Today we will talk only about stress incontinence, and briefly I would tell you about the modalities which are available to manage the stress incontinence. Now for stress incontinence, more than 200 surgical procedures have been devised. When we talk of 200, probably they were all devised because always an improvement was required, and the last surgical procedure which was devised now more than 20 years back, the transobturator tape or the TOT sling. Basically it mimics the urethral sport. It creates a artificial pubourethral ligament like sport and helps the woman to become continent again. Now this is an issue that only surgically can be done. A lot of women amongst you would not like to get a surgery done, because I get lots of patients with incontinence who are coming to me from across the country. Probably I get to see, or I have seen in all these past years, the biggest volume of incontinence patients. And when they come, many of them have been asking me that, doctor, we don't want to get a surgery done and we want a non-surgical treatment. Now because of this thing, today the science and medicine have become so advanced that we can offer even non-surgical management to majority of our SUI patients. It depends upon what degree of incontinence you have, mild, moderate or severe. You need to be thoroughly examined and evaluated by a reconstructive and a cosmetic gynecologist or a urogynecologist for that purpose, so as a complete management protocol can be created and designed and individualized for you, tailor made for you. So there is a possibility of non-surgical management of incontinence. Now how do we do it? Non-surgical management of incontinence can be done using energy-based devices, which are lasers, radio frequencies, plasma energies, and also the HIFIM devices. So we have different kinds of lasers available for it. You can use an erbium YAG smooth laser. You can also even use a carbon dioxide laser, a very typical, only 1 or 2 different kinds of carbon dioxide lasers which are safe to be used in gynecology. You can use radio frequency machines, and you can also use the latest cutting edge plasma therapy, the plasma energy therapy for managing incontinence. Besides this, you need a mix and match combination of the energy based devices and the magnetotherapy, which can be FMS or HIFM or HITS, which needs to be joined with it as an adjuvant therapy, and this is how the management of non-surgical management of incontinence can be done. Now the good news is that we have got everything what we are talking of here in this very center. Today I would not be discussing beyond this in detail towards the management part. I will also not be discussing how an individual management or a treatment or a modality works, but before we close today's discussion, I know what you want to see. You want to see what are the machines which are used for incontinence, and the highlight is the robotic laser which we have, by which we can manage your incontinence using a robotic handpiece, so that no human error can be done. There is zero possibility of human error in that particular technology, and the other technologies come. Let me show you today, before we finish this discussion, let me show you the first hand machines. Come with me. So let me show you what all we have. As I said, this is probably the world's most advanced laser machine, which is made for gynecology. If you see this, let me show you here. This is the Intima Laser Pro. This is the Intima Laser Pro, and this is the laser with the robotic handpiece. So if you see these application groups, there is Incontilase, Intimalase, Renovalase, Prolapsalase, and Incontilase Intra. These are all treatment modalities which are made for intimate health issues, and probably this is the only laser in the world which is specifically designed for gynecology. As you see this Intima laser, right, the laser for the intimate health issues of women. And all these things which we will be discussing separately, I just want to tell you two things today. Number one, this is the robotic handpiece, the G runner which you see, and this would run robotically, which I would show you in a different video. And then if you see this is Incontilase Intra. Incontilase Intra means the only laser handpiece which can be used inside the urethra to treat the intrinsic urethral deficiency. See this. Probably this is the only handpiece available in this country as of today, and we have got a zillion possibilities today to treat you with the latest cutting edge technologies which have all been imported from Europe and the United States. So this is one thing. Now let me take you to another cutting edge technology. This is the Starformer Pro. Again, the world's, I would say, the strongest and the most advanced magnetotherapy machine. If you see this, you can see it can treat incontinence, and even in incontinence, urgency, urinary incontinence, stress incontinence, prolapse, pelvic floor strengthening, prostatectomy, fecal incontinence. We will talk about it, the managements even for the erectile dysfunction and improving your sexual performance for men in this thing, but here we are talking of women. So this is probably the strongest magnetotherapy machine. It has got a magnet in the bum and a magnet in the back. Probably the most advanced and the only device available with this kind of configuration. And this is how we mix and match treatments. We tailor make the treatments as per your requirement. Besides this, we have a lot of other technologies available here with us, and I would today briefly show you what are the various equipments, machines and technologies available with us. We are the world's probably the best equipped reconstructive and cosmetic gynecology center. So as you see, you can see a multi-channel radio frequency machine. This is the new cutting edge technology, one of the latest plasma energy based technology machines. Again, this comes from Canada, this comes from Europe, the Czech Republic. Then we have the Thermiva. This is the oldest one with us, the first Thermiva of this very country in India since 2016 January. This was the first machine which came to us, and this was the first in the country. We still use it, although we have now better modalities. So you can see we have the Mona Lisa Touch there, we have the Exilis there, and then we at times take help of those machines also in managing the incontinence, and all of them have their role to play in intimate health issues. And then this is another nice thing which I want to show you is Emcella. Now this is I'm sure many of you would have seen this on the social media and your friends talking big about the Amsela chair. So this is an Amsela chair. It's a US FDA approved thing, for particular indications, but this is a chair which we again at times we take help of it in management of incontinence. Now this is not only this, we have got multiple other things. I would get back to you. I will show you each and every technology through this channel, each and every technology, how it is used, where it can be used, what are its uses, and where you should not use. I would definitely tell you what not to use, what to save yourself from, because what you need is two things. Number one, a reconstructive and cosmetic gynecologist, a well trained one, and secondly a well equipped center, because you can be the best craftsman, but if you don't have the right tools, you cannot create a great sculpture. So similarly, with the best knowledge, you need to have the finest, cutting edge, safest equipment, so that let's do no harm is the medical principle we must never forget. Thank you very much. This is all for today, what I want to talk to you, what I want to show you. But as you see, there's so much which I want you to know through the Healthcare Today. Keep tuned with me here. We care about you.